Welcome to another informative episode of Alberta Doctors Digest, brought to you by the Alberta Medical Association. You've tuned in to one of the many stories from our online publication at add.albertadoctors.org. We're the flagship source of information and opinion of the Alberta Medical Association, with a mission of advocating for and supporting Alberta physicians, strengthening their leadership in the provision of sustainable quality care. Let's get started. Well, hello everyone, and welcome to another episode of the Alberta Doctors Digest podcast, brought to you by the Alberta Medical Association. As always, I'm your host, Editor-in-Chief, Arvin Polis. For this episode, we're going to kick off a series about the Physician and Family Support Program, otherwise known as the PFSP. The program offers confidential 24/7 mental health and peer support services to physicians, medical learners, and their immediate families, including up to 6 hours of therapy per individual and 6 hours for family members to share. This is done through a personalized, non-call center approach, connecting callers to trained professionals and a province-wide therapist network, all while ensuring strict confidentiality and continuity of care. We're going to get into all of this in some detail, but first of all, let me introduce Fleur Umal. I'm here at her office. Fleur is the founder and CEO of Unify Consulting Group. The PFSP assistance line is supported by Unify Consulting Group. Fleur, tell me about you. Tell me about your company.
I'm a trained clinical social worker. I've been in practice for about 25 years. And my company, Unify Consulting Group, is a small but mighty employee assistance program based out of Calgary. And we provide mental health and organizational wellness services for several organizations, the PFSP being one of them. So the reason I do this is because I'm passionate about removing the barriers that a lot of people experience in asking for help and for accessing services. I think that those are probably the two greatest obstacles that people have to overcome when they're struggling with mental health. To know when to ask for help and then where to get that help from. And so for me, helping people get to where they need to get to be healthy and well is probably what makes my heart soar.
Okay, now, of course, that's a very worthy mandate. Can you tell me more about your objectives and what you hope to accomplish?
Our main objectives at Unify Consulting Group is to really remove these barriers that prevent physicians, medical students and residents, and their immediate family members from accessing services that they need, whether it's a crisis situation or it's an ongoing issue. The different ways that we do this is by being available 24/7, 365. We answer the 24-hour assistance line. We have a dedicated team of intake and assessment coordinators who will answer the phone. They're all trained to do risk assessments and to provide best fit referrals to therapists. Our goal is also to maintain confidentiality and ensure that anyone who calls the assistance line feels that the information they share with us will not go directly to the Physician and Family Support Program or the Alberta Medical Association. Being the third-party service provider allows us to be one step removed from the PFSP and the AMA, which only enhances the confidentiality and the comfort that clients accessing the program can have.
Well, now I'm even more curious. I understand that the people who answer the phones, they're not actually what most of us would perceive as call center people. Can you tell me all about how that makes Unify unique?
What makes Unify Consulting Group very unique is the fact that we are not a call center. Every person who answers the phone has a bachelor's degree in social work or psychology. Each person is trained to do risk assessments and to ensure that the person calling the line is well supported in the moment and that their questions or their queries or their concerns are met with an empathetic and compassionate ear. Our goal is to create the best fit to a therapist because we know that oftentimes it is very difficult to make that first step to ask for help. And the last thing we want to do is connect someone to a therapist that isn't a good fit and may provide, again, one of those barriers to really looking after themselves and getting the help that they need.
Okay, so that's great background about the people who take care of the assistance line. Fleur, now tell me about the background and qualifications of the therapists
Our therapists that are part of our network are all trained at a master's level, and they specialize in different disciplines such as psychology, social work, counseling psychology. They are required to have a minimum of 4 years post their master's. They need to hold a certain amount of liability insurance. And what's probably most important for us is that they really understand the culture of medicine. One of the biggest pieces of feedback that we get when we follow up with clients upon closure of their file or midway through is that they really appreciate not having to explain everything about medicine. They appreciate that therapists understand that the challenges that they face as physicians are so unique and so different from what many other professionals would experience. And they really value therapists who understand the culture of medicine. And so for us, vetting therapists who have had experiences in this realm or have worked with physicians is super critical in onboarding them into our network.
Okay, so we've talked about the intake coordinators who answer the phones and the therapists. I understand the PFSP also has assessment physicians who speak to callers on the assistance line. Fleur, can you tell me about the peer support they provide?
One of the biggest pieces of feedback that we get is how much our callers and our clients appreciate that physician peer-to-peer support, how much they value being able to speak to a colleague about the different challenges that they're experiencing, to get some validation around the feelings that they're having, and to get some of that resourcing and strategizing around how to move forward. And so for me, I think that is probably one of the most unique aspects of our program is that you have that physician peer that you can speak to 24/7, 365. Nothing more validating than hearing a physician who's been through something that you've been through and knowing that while your experience is unique and your emotions are unique, that you reaching out for help and needing the support is absolutely 100% where you need to be.
Something else I wanted to ask you about, Fleur, is what are some of the reasons people call the assistance line?
Some of the reasons that people call the line are varied and vast. So people can call around mental health struggles such as depression, anxiety, grief, suicidal ideation, eating disorders, and the whole gamut of mental health issues that may be impacting your work, your relationships, your family members. And one thing to remember is that it doesn't have to be terrible before you call, right? We really love the proactive nature of it, even though for a lot of people it might feel like it's not quite a big deal yet, but just understand that it can be a bit of a slippery slope. Some of the other reasons that people call are around relationship or family issues, so couples counseling, family counseling, dealing with aging parents, dealing with adult children. We also do psychoeducational assessments for children. Callers also call us around learning issues if they're struggling, whether it's through medical school, residency, and actually for anyone who is concerned about any learning issues or anything that may be getting in the way of your ability to process information and providing support around learning issues. We also provide services for third-party callers, and these are people who are concerned about a physician, whether it's in their family, whether it's a colleague, and this is, again, the support that our assessment physicians provide to people who are concerned about the well-being of a physician. I think one of the greatest barriers that physicians have in accessing services is the idea that they are often put on a pedestal. They're expected to wear the cape. They're expected to fly around and save everyone's lives and to never bat an eyelash at it. And so I think people identify with that. And the minute that there's a crack in the armor, the feeling is somehow I failed. The feeling is somehow I was never meant to do this. The imposter syndrome that many physicians feel in doing their jobs, in being with their families, in socializing with their friends, really rests on this identity of I'm here to save lives. I'm here to make sure that everyone lives. And I think that amount of pressure can't do anything but possibly put a crack in the armor.
Understood. Now, I think a lot of our listeners might want you to dive into the weeds just a little bit and tell them exactly what to expect when they call the line. What can you share about that, Fleur?
I think this is probably one of the biggest barriers because you just don't know what to expect. So the first thing you can expect is that you'll be greeted by one of my team members. They will ask you to provide your name, some demographic information, contact information, so that we can create a file and assign you a confidential client ID. The next step in our process is to have you speak to our assessment physician so that we can get a sense of what's going on for you and all the things that are contributing to whatever it is that you happen to be struggling with. And it can happen anytime. And we really want you to be in a place where you can speak freely and speak confidentially so that you can share your complete and full story. Once we get the report back from the assessment physician, we use that information to connect you to a therapist in your area. You see the therapist bills us directly for services, and then once you've completed your hours, you're welcome to continue to see this therapist. We believe in the continuity of care. We believe that once you've established a meaningful therapeutic relationship, that we would never want to disrupt that. In the off chance that we happen to refer you to somebody that is not a good fit, we are more than happy to make a re-referral in that case. So we do want your feedback. We want to hear back whether or not things are going well. In some cases, if you already establish a therapeutic relationship with a therapist who is not part of our network, we are more than happy to onboard them, ensuring that they have the proper credentials and ensuring that you can continue in this therapeutic relationship.
Now, I'm also curious about the data you collect, how you keep it confidential, yet how it's used to help PFSP understand the issues and provide insights in the long term.
The statistical information that we gather through the line is such a critical part of ensuring that we're providing relevant and meaningful services to physicians. They carry a great burden, their jobs are very stressful, and their needs are ever changing. And so one of the things we want to do is make sure that we're capturing data that is current and relevant, and that we're able to provide that feedback to the AMA and the PFSP confidentially so that they can use that information in a meaningful way to service the AMA population. One thing to know with our program and our system is that we assign a confidential client ID to each person who calls in. The data that we then collect for that person is attached to that client ID. It's never attached to your name. It's never attached to any information that is personal or professional. That's how we collect the aggregated data and maintain confidentiality, is by taking all of the accesses as non-nominal information, put it through our statistical analysis, and then be able to provide both anecdotal and quantitative information so that that information can be useful for the Alberta Medical Association. It is up to us to maintain your confidentiality and protect your privacy. So none of the information will ever get back to the Alberta Medical Association or the Physician and Family Support Program unless you choose to share that information.
Fleur, we're just about out of time, but before we wrap up, is there anything else you want to say?
I'd like to finish by saying that one of the reasons that I'm so passionate about the work that I get to do now is because I've been part of the PFSP for the span of my career. I started out as a therapist in the network, seeing medical students, residents, physicians in all stages of their career, and now moving into administering the program and my amazing team of intake and assessment coordinators that you get to speak to. And so for me, this is near and dear to my heart. One of the things that I believe about physicians is that it is very difficult at times to ask for help, to recognize that you're struggling. And my passion and my goal is to remove all those barriers so that you can get the help and assistance that you need to be well, because we need to be well and we count on you to be well. It is never too early or too late to call us.
Splendid. And with that, we'll wrap up. But before we go, I'll just mention that the phone number for the 24/7 confidential assistance line is 1-877-767-4637. Thanks, Fleur. Thanks again for tuning in to Alberta Doctors Digest, brought to you by the Alberta Medical Association. This has been just one of the many stories from the current issue of our online publication. You can read the entire publication at add.albertadoctors.org. See you next time.